Hello, everyone. Welcome back. This is Dr. Nissan. I'm a hospitalist. And today we're going to talk about epinephrine. Um, I've always found this topic pretty interesting. I think if you're like me and you work in the healthcare setting, you imagine yourself in emergency situations outside the hospital setting. Um, and particularly for this example, this would be for in-flight emergencies on airplanes. Um, and I included this table here at the bottom. Apparently, this is what's required by the Federal Aviation Administration in the medical kit. And for epinephrine, they include epinephrine 1 to 1000, the one used for anaphylaxis. They require 2 vials of that. And then the epinephrine 1 to 10,000 used for cardiac arrest, they require 2 amps of that. And they also include a 500 ml saline solution bag, and they only include one of those. So we'll go ahead and talk about the epinephrine here. This is the epinephrine chart. I made this. This is all, created by myself. I did all the math here. Um, so we'll go ahead. So we're going to start with the 1 mg per ml of epinephrine. The concentration is 1 to 1000. And this is used for anaphylaxis. And I included these images here. These are the vials that they look like of the concentrated epinephrine. And the dose is going to be 0.3 to 0.5 milligrams of epinephrine. And you give that intramuscularly. And you give that every 5 to 15 minutes as needed for anaphylaxis. Usually you only require 1 dose, but sometimes these people, they require multiple doses of epinephrine for anaphylaxis here. And the math is 1 milligram per ml. So to give, for example, 0.5 milligrams of epinephrine, you give 0.5 mLs of this solution here. So that's the concentrated epinephrine for anaphylaxis. The next epinephrine is the 0.1 mg per ml, or the 1 to 10,000 concentration of epinephrine. And this one's used for cardiac arrest. And this image here, this is the epinephrine, usually found in the code cart, used for cardiac arrest. And or you can also use this. I made this image here. What you can do is you can take this vial of the concentrated epinephrine and you can combine it with the saline flush. And the way you would do that is you would remove 1 ml of the saline flush and you would replace it with 1 ml of this epinephrine. And that creates a diluted version of this epinephrine to equal that of uh, uh, the code epinephrine. So, and the dosing for epinephrine for cardiac arrest, you give 1 milligram total of epinephrine, which equals a 10 ml push of the entire vial here. And you would give a 1 milligram epinephrine push every other pulse check. And the time comes out to every 3 to 5 minutes as needed for cardiac arrest. Um, but every pulse check during CPR is every 2 minutes. So when you do every other pulse check, it comes out to 4 minutes. So that means the 3 to 5 minute mark. So it's just a quick way of thinking about when to give the next epinephrine dose. And the next epinephrine is going to be your push dose pressor. Again, you're in a scenario where you're limited on resources. You don't have other options for medications. You have this patient who's in shock. They're on the verge of going into cardiac arrest. And the best treatment for that patient is to give a push dose pressor, just to temporarily bring their blood pressure up until they receive definitive treatment. And the way we can do this is we can take this epinephrine, the one used for cardiac arrest, and you can do the same thing where you take a 10 ml saline flush, you get rid of 1 ml, and you draw 1 ml of this epinephrine. And what that will do is that will dilute it, and that will make a 10 microgram per ml concentration of epinephrine. And for a push dose pressor, the dosing, you give 0.5 to 2 mLs of this concentration of epinephrine, which comes out to 5 to 20 micrograms of epinephrine total, respectively. And you would give this as a slow IV push, and you would give this every 2 to 5 minutes as needed until you have a better blood pressure, ideally with the MAP greater than or equal to 65 millimeters mercury. Now, once you've given this push dose pressor, the blood pressure looks a little more stable. And let's say you're on a flight in an airplane, and you need to stabilize this patient for an extended period of time. What you can do is you make the dirty epinephrine drip. It's very famous. A lot of people have heard about it, but this is how you make it. And for this particular example, I used a 500 ml normal saline bag because on the flights, they require a 500 cc bag of normal saline, and you get 1 bag of it. So what you do is you take either this epinephrine here, or you take this epinephrine here, which is your cardiac arrest epinephrine, and you place either one of those into this normal saline bag, this 500 ml saline bag, because they both equal 1 milligram of epinephrine total. So you put 1 milligram of epinephrine into this normal saline bag. And for this example, it's a 500 ml normal saline bag. And when you put 1 milligram of epinephrine into a 500 ml normal saline bag, you create a 2 microgram per ml concentration of epinephrine. And the dose for an epinephrine drip is 2 to 20 micrograms per minute. And using the standard drips per second, which is 15 drips per second. And if you do the math with this concentration, it comes out to 0.25 drips to 2.5 drips per second. And that's just a quick, easy way to know how many drips per second to give with a dirty epinephrine drip when you're trying to save someone's life and you're doing everything you can on an airplane. And obviously you can't titrate a quarter of a drip every second. So you have to do the math yourself. You have to extend it out. So 0.25 drips per second, that comes out to 1 drip every 4 seconds. And 2.5 drips per second is a little more reasonable. But if you wanted to, you can extend that out to maybe 5 drips every 2 seconds. But that's just something just a quick way to know how to dose a dirty epinephrine drip. And if you wanted to do this in a 1 liter normal saline bag or 1,000 mLs of normal saline, then the concentration would just cut in half. So it would be 1 microgram per ml. And the dose for epinephrine drip is still 2 to 20 micrograms per minute. And the drips per second would just multiply by 2 because of the lower concentration. So it'd be 0.5 to 5 drips per second in a 1 liter bag. So that's epinephrine in a nutshell. Again, this is an epinephrine chart. I made this. You can use it if you'd like. Just a quick summary: 1 mg per ml or 1 to 1,000 is used for anaphylaxis. You use 0.3 to 0.5 mg per ml IM every 5 to 10 minutes for anaphylaxis. The 0.1 mg per ml or the 1 to 10,000 epinephrine you use this, or you can dilute this one and use that for cardiac arrest. And you give 1 milligram total, which is 10 mLs. And you give that as a push every other pulse check during CPR. And if you want to make a push dose pressor, you just take this and you dilute it here with the saline flush. And that's a 10 microgram per ml. And you give 0.5 to 2 mLs of that, which is 5 to 20 micrograms respectively. And you give that as a slow IV push every 2 to 5 minutes. And then if you want to make a dirty epinephrine drip, you either take 1 milligram epinephrine here or 1 milligram epinephrine here, and you inject either one of those, the entire milligram, into normal saline. And for this example, I used a 500 ml normal saline bag. Concentration comes out to 2 micrograms per ml in a 500 ml bag. And the dose is 2 to 20 micrograms per minute. And if you use a standard 15 drip per second rate, the drop factor, then the math comes out to 0.25 to 2.5 drips per second. Just a quick number to have in your head when you're titrating a drip. For someone who's in shock on an airplane and you just need something quick, just a rough estimate of how to titrate a drip. When you're in an emergency scenario, you don't have resources, you're limited on options, you don't have an IV pump, obviously, and you're kind of doing this on your own. So that's epinephrine. If you guys have any questions, or if you have any comments, feedback, or if there's anything else you want to talk about, let me know in the comments below. I'll read them, I'll respond to them, and sounds good. I'll see you guys in the next episode. Bye-bye.